This short video is a review of the importance of conducting a proper risk assessment regarding rehospitalization in order to comply with the conditions of participation set forth by CMS, as well as provide a brief guideline on how to complete OASIS M-Item 1033. For additional information, please consult the OASIS D Manual, Chapter 3. According to the conditions of participation, Section 484.60 A.2.12 Standard Plan of Care, the standard POC must contain a description of the patient's risk for emergency department visits and hospital readmission, and all necessary interventions to address the underlying risk factors. In order to comply with regulatory requirements, the assessing clinician must code M1033 risk for hospitalization within the OASIS dataset. This M-Item is required to be coded at all OASIS time points except discharge. Note that the assessing clinician should mark all responses that contribute to the patient's risk for hospitalization at the time of assessment. Previously, this section was a blue section. WellSky has updated M1033 section to be pink, meaning the data collected will now automatically populate to the physician orders for inclusion in the plan of care. Coding the risk factors meets only part of the Medicare regulation. The clinician must also ensure the plan of care includes interventions to address the risk factors. Let's consider each response and potential interventions to meet the regulation. Response 1. History of falls. The clinician should assess if the patient has experienced 2 or more falls or any fall with an injury in the past 12 months. Remember, a fall is defined as any unintentional change in position from a higher to a lower level, and it can be witnessed or unwitnessed. Information should be obtained from prior medical records and interview of the patient and/or caregivers. Appropriate interventions to include on the plan of care might be: refer to physical therapy and/or occupational therapy. Conduct a thorough assessment of the patient's environment, grab bars, throw rugs, etc. Complete the fall risk assessment within the OASIS. Perform medication review and reconciliation at each visit, and consult physician regarding potential drug-related causes for falls. Assess and intervene related to vital sign changes such as orthostatic hypotension. Assess for improper use of or non-use of prescribed DME and instruct in safe use. Response 2. Unintentional weight loss of a total of 10 pounds or more in the past 12 months. As part of the physical assessment, a baseline weight should be assessed. Additionally, the patient history and physical, hospital records, or other documents should be reviewed, as well as interview of the patient and/or caregivers. Appropriate interventions to include on the plan of care might be: assess weight and teach maintaining weight log. Assess dietary intake and teach maintaining dietary log, including exploring foods that are palatable to patient. Assess intention and oral cavity regarding effects on eating. Teach regarding dietary supplements such as Ensure to improve caloric intake. Obtain an order for a dietary consult. Assess for proper level of care if loss is disease process or aging related. Obtain referral for palliative or hospice. Obtain order for MSW eval for assistance with home delivery meal programs, etc. Obtain order for occupational therapy for intervention regarding difficulty with feeding self or meal prep. Obtain order for speech therapy evaluation. Responses 3 and 4. Multiple hospitalizations, 2 or more, in the past 6 months, and multiple emergency department visits, 2 or more, in the past 6 months. This information should be obtained within the patient history and physical, as well as other medical records. And of course, interviewing the patient and caregiver is also necessary to obtain all the information. Appropriate interventions to include on the plan of care might be: teach regarding making and keeping routine physician appointments. Teach regarding contacting home health agency and/or physician for non-emergency medical needs. Instruct in available urgent care locations. Assess for the appropriate level of care and obtain referral for palliative, hospice, or even direct admit to SNF if warranted. Obtain order for MSW referral for completion of advance directives and/or POST to protect patients' wishes regarding medical treatment. Response 5. Decline in mental, emotional, or behavioral status in the past 3 months. This information should be obtained within the patient history and physical and other medical records. Interviewing the patient and caregiver is also necessary to obtain all the information. Assessment of the following might indicate an appropriate reason to code 5 within M1033. Recent increased forgetfulness, increase in uncooperative behavior, decline in desire or ability to maintain personal appearance or engage with caregiver or family. Appropriate interventions to include on the plan of care might be: obtain a referral for MSW eval. Assess neurological status at each visit. Response 6. Reported or observed history of difficulty complying with any medical instructions, for example, medications, diet, exercise, in the past 3 months. A person who has a history of poor self-management of diabetes or heart failure, either by choice or by environmental barriers, such as transportation issues, caregiver issues, financial limitations, would be one example for selecting response 6 in risk assessment. Appropriate interventions to include on the plan of care might be: obtain referral for MSW eval for supportive services. Use motivational interviewing for establishing patient-driven goals for home health services. Assess patient or caregiver ability to perform teach-back regarding self-care education. Response 7. Currently taking 5 or more medications. As a reminder, this includes all medications, prescription, over-the-counter, supplements, and oxygen. Everything the clinician would list on the medication profile would be considered here. Appropriate interventions to consider for inclusion on the plan of care could be: assess for automatic refills from pharmacy, which may or may not be current medications. Perform teaching on each medication by discharge. Perform medication reconciliation every visit and update the medication profile. Assess patient and/or caregiver ability to manage medications appropriately and safely. Assess and instruct on signs and symptoms of ineffective drug therapy. Establish reminders to alert patient to take medications at correct times. Response 8. Currently reports exhaustion. According to the OASIS interpretive guidelines, exhaustion could be physical or mental. The assessing clinician must be observant and ask questions during the start of care. For example, ask the patient to describe his level of energy, physical and mental, have the patient describe his quality of sleep, and have him describe his current level of activity, comparing it to prior performance and desired goal. Ask patient to describe what routine activities he has been able to resume. These probing questions will assist in an accurate assessment of the item. Appropriate interventions to include on the plan of care might be: assess for underlying causes of exhaustion and implement strategies to resolve or improve exhaustion. Obtain referral for MSW eval. If there are other risk factors not listed in response 1 through 8, you should mark response 9. Other risks not listed in 1-8. Additionally, the clinician should document the additional risk factors not covered in Response 1-8 in the Additional Risk Information section. For instance, slower movements during sit-to-stand and walking, uncontrolled pain, or lack of in-home support might be additional factors contributing to increased risk for rehospitalization. Others could be multiple comorbidities, chronic or terminal illness, poor socioeconomic status, lack of funds to obtain health services or meet basic needs such as food or medication, homelessness, frequent UTIs with history of sepsis, and more. The corresponding plan of care interventions should be based on the additional risk factor noted, but could include actions such as obtaining a referral for other disciplines, nursing, PT, OT, ST, or MSW, or providing caregiver teaching regarding UTI signs and symptoms and perineal care. Here is a sample plan of care with the risk factors now included. Notice in this example, the clinician chose option 9, other risks not listed in 1 through 8. However, he did not include additional information. As previously presented, it is important to specify the other risk factors so they will be included in the plan of care. This concludes our brief review of OASIS M1033 Risk Assessment. Please contact your managers or education for additional questions.